My name is Anjikongare. Welcome to my YouTube channel. If you have not subscribed to this channel, kindly do so. Remember to hit that like and notification bell for any time we upload a new video. You will be among the first person to be notified. Today we are going to talk about pre-operative assessment, evaluation assessment of a patient before they go to the theater, and we have a parameter or a tool that we will use, which we call the ASA, or the American Society of the Anesthesiologists. They have come with a parameter that assesses the outcomes that we expect. Point to note is this is not designed as a quantitative risk calculator. The ASA is divided into at least 6 groups, which we have ASA 1, which has a normal healthy patient. We have the ASA 2. This is a patient who has a mild systemic disease. We have the ASA 3. This is a patient with severe systemic disease. Then we have ASA 4. This is a patient with a severe systemic disease and is not expected to survive without this surgery. Then we have the ASA 5. This is a patient who is moribund and is not expected to survive if this surgery is not done at all. Then we have the ASA 6, which is a brain dead patient. Then we'll go into details and discuss each category and the example of patients who are there. We start by the ASA 1. In this category, have a healthy patient, non-smoking, maybe patient who does not even take alcohol, and etc. Then we have ASA 2. This patient, they are the current smokers. Maybe you can put pregnant patients in this category, obese patient who has whom they are diabetic or their hypertension status is well controlled. You put them in this category. Then we have the ASA 3, of which we put the patient whose their diabetic or their hypertension status which is not well controlled. You can put them there. A patient who has COPD, a patient who has active hepatitis, you can put them there. Then we have a patient who has an implanted pacemaker. We put them in ASA group 3. Then we have group 4. These are patients with an ongoing cardiac ischemia. We put them there. Patient with sepsis, patient who are going for dialysis, patient who has a severe reduction of ejection fraction. Then we have patient in group 5. We put them patient who has things like massive trauma, ruptured abdominal aneurysm, patient who has a ruptured thoracic aneurysm, and etc. Then we have group 6. These are already patients who are brain dead. So majorly these surgeries, they are done for maybe organ transplant. Now, another thing to note is as we go from class 1 to class 6, that is how the risk increases. We don't expect a patient in group 1 to go to the theater and maybe we lose that patient. But if we take a patient in group 5, chances of losing this patient it may be at the higher side, you see. So that's why the anesthetist came with this parameter to categorize this patient and the risk involved when they go into the operative or intra-op. Adios.